Hello, I'm Darieth, and I want to welcome you to our interactive cancer care navigation coach. You may be coming into this program after your doctor has told you that you have lung cancer, or you may be a caregiver of someone who has lung cancer. No matter what brought you here, I want you to keep one very important thing in mind as you use this program. New treatments for lung cancer are being discovered and tested through clinical trials all the time, and these discoveries are helping people with lung cancer live longer and better lives than ever before. Yes, this is a serious disease, and yes, it can be life-threatening, but there are treatments for every stage of lung cancer that will help you in your fight against this disease. We developed this program to make it easy for you to get all the information you need when you need it. We know facing a cancer diagnosis is scary. There is a lot of new information to take in, important decisions to make, and you probably have many questions. There is a lot on your plate, but don't let it overwhelm you. You have a cancer care team that will be coaching you through it, step by step, and telling you what you can expect at each stage of your journey. Your cancer care team includes the many skilled healthcare providers you will see during treatment, as well as myself and other online guides that are available 24/7. Having cancer doesn't just affect your physical health. Even the possibility of a cancer diagnosis can cause fear, anxiety, depression, and even guilt. These emotions are normal, but you should not ignore them. Taking care of your emotional well-being is as important as taking care of your physical health. Have you been told what stage your cancer is? Treatment for non-small cell lung cancer at stages 1 and 2 is generally surgery to remove the tumor. The type of surgery your doctor will do depends on where the tumor is located and how big it is. Surgeons remove the tumor and some of the healthy tissue around it. The healthy tissue surrounding the tumor is called the margin. The removed tissue will be looked at under a microscope to see how wide the margin of healthy tissue is. Doctors like to see a wide margin of healthy tissue around the tumor when it is removed because that means it is likely that they were successful in removing all of the cancer cells. If the margin of healthy tissue is narrow, your doctor may recommend another surgery to try to remove all of the cancer cells, or radiation or chemotherapy to kill any remaining cancer cells. When talking about a cancer diagnosis, some people feel that it's important to get all the details about their prognosis right from the start. They want to know how the cancer will affect them and how long they can expect to live. Other people prefer not to discuss their prognosis right away. They may feel that knowing their prognosis is depressing or bad luck. But we want you to be fully informed at each step of your treatment because knowing the prognosis for your specific type and stage of cancer can help you better participate in your care, make treatment decisions, and plan for the future. So I have a very important question to ask you. Do you want to learn more about your prognosis now, or do you want to come back to this topic at another time? Chemotherapy medications work by stopping the cancer cells from growing and dividing. Chemotherapy may be given by intravenous or IV tube and needle called infusion. Some chemotherapy medications are given as an injection, like a shot, or can be taken in pill form. You may take one chemotherapy medication or a combination of medications depending on your cancer and what stage it is. The side effects of chemotherapy depend on the individual, the type of medication, and the dose your doctor has prescribed you. They can include fatigue, nausea, vomiting, loss of appetite, hair loss, low blood counts, mouth sores, and an increased risk of infection. I encourage you to talk to your doctor or nurse before starting your treatment so you know what the most common side effects are from the medications you are taking and when they can occur. Mucositis is very common in people getting chemotherapy or radiation, and most people will have at least some mouth sores over the course of their treatment. Your healthcare team will do everything they can to help prevent mucositis while you're in treatment, but there are steps you can take to reduce mucositis as well. Before treatment, see a dentist who deals with cancer patients. If you need any dental work, such as a tooth extraction or cavities filled, it should be done at least 1 month before you start therapy so that your mouth can heal completely. Good oral care, including brushing and flossing regularly, can help prevent or decrease the severity of mucositis, and just as important, help prevent infection. Use a soft bristle toothbrush and mild tasting toothpaste with fluoride, and brush your teeth after each meal or at least 2 to 3 times each day. If you experience sensitivity or mouth sores, you may need to use foam toothbrushes with an antibacterial rinse. You should also gently floss your teeth only once daily. Rinsing your mouth regularly with salt water after meals and at bedtime is one of the best and most cost-effective ways to remove debris and keep your mouth moist and clean. You should also avoid alcohol and spicy, hot, or acidic foods like lemons. Also avoid coarse foods that can damage the lining of your mouth, like very dry toast. Drink more liquids and try to include foods high in protein in your diet. If you smoke, it is extremely important that you stop. Your doctor may be able to prescribe medications to help you. Keep lips moist with moisturizers, but avoid using products like petroleum jelly, like Vaseline, because they can increase the risk of infection. And if you wear dentures, make sure they fit properly and remove them whenever possible to expose your gums to air. You may need to stop wearing your dentures if your mouth sores are severe. It is important to keep ahead of mucositis to prevent it from becoming worse and delaying your treatment. Alert your healthcare team as soon as you notice any of the symptoms of mucositis so that they can help keep it from getting worse. The After Hours Clinic is located at West Penn Hospital on the 3rd floor, Suite 340, and sees patients from 3 to 9 p.m., Monday through Friday. The clinic has cancer specialists available to help you with your symptoms, and you can avoid long waits in crowded emergency departments. The clinic treats pain, fever, fatigue, upper respiratory infections, coughing, painful mouth sores, nausea, vomiting, diarrhea, and constipation, dehydration, and rashes. If it is before 4 p.m. and you're having any of these symptoms or others that may be related to your cancer diagnosis or treatment, call your oncologist first. Together, you can decide where you should go for care. If you need to come to the clinic, your doctor will call the clinic so they can get ready for you. If it is after 4 p.m. or you cannot reach your own doctor, have questions, or need directions, please call the After Hours Oncology Clinic directly at 412-770-3070. There are many different types of cancer treatments, and if one type of treatment doesn't work for you, your doctor may recommend a different treatment or suggest that you try a treatment that is being tested in a clinical trial. But there may come a time when you've tried many treatments, but they are no longer controlling your cancer. If the available treatments are no longer effective, you should talk with your doctor about whether the risks and side effects of treatment outweigh any benefits you may get. It might be that it is unlikely that more treatments will improve your health or help you live longer. Even if this is the case, there are things you can do to help maintain or improve your quality of life. Supportive or palliative care can help ease symptoms and manage side effects. For more information on supportive care options, look at the links to the right. You may hear about new cancer tests and treatments in the news as researchers uncover new insights, but keep in mind that many of the advances you hear about are still in the experimental stage and may only be available through participation in clinical trials for patients who meet the eligibility requirements. If you have questions about tests or treatments that you've heard about, ask your cancer care navigator or oncologist. They can tell you whether the treatment is appropriate for your type of cancer and whether it is available outside of a clinical trial. You can find information on clinical trials by visiting the clinical trials website using the link in the resource area. You always have the right to get a second opinion or to have more tests if you feel as though your diagnosis or prognosis may not be correct. Also, keep in mind that our renowned doctors provide high-quality, compassionate care for every type of cancer and follow universally accepted treatment standards set by the National Comprehensive Cancer Network, an alliance of 27 leading cancer centers. Our physicians participate in Allegheny Health Network tumor boards, where doctors discuss cases, get input from other physicians and healthcare providers to ensure that your doctor prescribes the best possible cancer treatment and care plan for you. We also belong to a cancer collaborative with Highmark and Johns Hopkins Kimmel Cancer Center, which, among other benefits, gives our patients access to experts in rare cancers and priority participation in innovative clinical trials. Another thing to keep in mind when considering a second opinion is that some insurance plans may not pay for consultations or tests that they feel are not warranted, or you may need to pay for these services out of pocket. For more information on our relationship with Johns Hopkins Kimmel Cancer Center, look in the resources area. The number one thing you can do to prepare yourself for lung cancer surgery is to stop using any tobacco products as soon as possible. Not only does smoking affect the health of your lungs and other organs, but any form of tobacco use slows down the healing process. Your doctor may ask you to use a spirometer before surgery to strengthen your lungs and the muscles in your chest that help you breathe. Using a spirometer regularly before surgery can have a big impact on your recovery after surgery. There is information on spirometer use in the resource area. Also, stay as active as possible leading up to your surgery. Eat a good diet and follow the pre-surgery instructions that your healthcare team gives you. There is more information on preparing for surgery in the resource area.